Good evening, everyone. We're also doing this short series interview preparations for upcoming electoral residency applicants. That means those that are applying for residency positions in the US. My name is Dr. Kobe. I'm a family physician in training, and I help guide foreign trained physicians to uh, become better speakers, more confident in their answers. And other areas in interview preparations that we do. We do this one-on-one coaching. Today we have our two top bright candidates who we'll be asking, we'll take a prototype question and then we'll ask them. Um, I use Dr. Wendy. She's all the way from Ghana. And then Dr. Hassana, all the way in the US. I'm somewhere around the world trying to be happy. Um, but I'm not in Kenya Islands or the Caribbean Islands enjoying myself. I'm on duty, actually, somewhere around the world. Um, there's a question that usually comes in the interview that says, what are your goals in residency? People confuse it. So, Dr. Wendy, I want to give it a trial. Just keep your answers short. So we're going to explain later. Um, and then Dr. Hassan, I'll give it a trial.
Okay. So I think my topmost goal in residency is to be proficient in managing cases related related to internal medicine. Um, the second reason is the second goal for me is to also further develop my soft skills and my empathy and how I communicate effectively to my patients, explaining their disease processes to them. Last but not the least, is also I further want to develop my leadership skills, and I hope to take up some leadership roles in the program so that I can heighten my leadership skills. Thank you.
Absolute. Great answer. Dr. Hassan, pitching from another perspective, your goals in residency.
Okay. One of my goals I'm looking forward to having in residency is to be this highly skilled physician that uses evidence-based guidelines or evidence-based medicine to see that my patients have the best of care. And then also another goal is to see that I become very efficient, very proficient in delivering on the patient's care.
Absolutely. Brilliant answers. And there are so many things that you can talk about goals in residency, right? When they ask you such questions, as a resident, there are different things that we want to achieve, right? So you pick from one or two or three, like both of you have said, and then go to town, add some flesh to it, create a picture of that good resident. Your responses are good, probably because I told you to make them short. You could make it a little longer, just a little longer to, add some drama, add some, eventfulness. Uh, in coming into internal medicine, part of my goals, right, is to grow in clinical knowledge and my diagnostic skills, to be proficient in my clinical knowledge and my diagnostic skills. What I mean is I want to be able to understand or gain mastery in a broad range of diseases, right? Including, we are talking about internal medicine now, so I need people to use industry lingua, including, disease, understanding the cardiovascular system and the different shades of presentation, pathological presentation, how they are managed, endocrine diseases, infectious diseases, autoimmune diseases. So I want to be proficient in this, improving my diagnostic acumen, taking good history, conducting comprehensive physical exam, growing, arriving at appropriate diagnostic, accuracies, right? And then using evidence-based, that word evidence-based is very big in the US, using evidence-based diagnostic approaches or management approach or guidelines to help modulate my treatment and grow in it and improve. Another goal that you can also talk about is, to be improving your understanding of, the different shades of disease presentations. Let's say chronic, how to manage chronic diseases, how to manage acute care, differentiating between acute care and emergency management, right? Because they all present they all present in different shades, and for you to for you to be able to identify each one, right? Identify that, oh, this is a chronic case, I need to follow up, add wound care, add infectious disease, and follow up admission, send to LTAC, not sent to LTAC, send home with oxygen, not send home with oxygen, gold criteria for COPD management. Patient came, I need to give a LABA-LAMA ICS. Those are like chronic cases. It's different from an asthmatic that came and I'm giving ICS in here because ICS plus SAM or plus SAMA or LABA, whatever it is, short-term acting beta agonist, right? Or SABA, right? So, I want to be able to grow proficiently grow in this aspects of patient management. You can add, another component of patient management, preventive care, emphasizes disease control, educating patients on weight loss, smoking cessation, exercises. Because believe it or not, in residency, initially, you may not even know that these things play a role in patient management, right? Improving your clinical knowledge and diagnosis skills. So you want to be able to grow in these areas that I've mentioned. Another goal is to improve in your procedural skills, so learn more, master bedside procedural skills, and then I need you people to mention it because that makes you bring it home to the program, bring it home to the subspecialty. If it's psychiatry, you're mentioning those procedural skills that you're hoping to learn, like lumbar puncture, thoracocentesis, paracentesis, central line placement, how to read or collect ABGs, how to do joint aspirations, there's so many of them. How to interpret EKGs, CT scans, right? So many of these skills, procedural skills that you want to learn, right? I was telling you people a story where learning ACS algorithm, how to do advanced cardiac support is a big deal. Sometimes I tell my wife when we're flying, I say, please don't identify me as a doctor because I don't want somebody to code in this plane and they will call any doctor in this. Is there any medical personnel? And then you'll be the one to get up, right? And then go and start administering CPR and ACL and check pulse and every 3 minutes give epinephrine and all those different stuff, right? With nothing, I'll probably do chest compressions and pad and shock and the rest. So for you to be able to do that confidently, I think is a goal, right? And I classify those goals as these things I've mentioned as the procedural skills that you are required to get. And I've mentioned it later. And when you're using procedural skills as a goal, you have to mention one or two, right? And then another important goal in um in residency is your interpersonal communication and soft skills, your ability to be empathic, compassionate. It takes genuineness, it takes growth to come to that level, to know that this patient is actually passing through pain and he's not just requesting for pain medication because he's an addict. Yeah, he's an addict, but he's actually having pain. I need to control his pain. It takes empathy to follow your patients, right? Effective communication, explaining diagnosis, treatment options, ways on how patients can understanding it, right? Um, these are all interpersonal soft skills, being able to be resilient during stress, working with your colleagues, maintaining high professional standard and boundary, accountability, punctuality, for example, respectful interactions with your colleagues and even with your patients, right? Growing in cultural competencies. I want to be able to grow interpersonal skill, connectional skill, cultural competence, being sensitive to cultural, religious, and socio-economic factors that could influence patient care and decision making. Patient doesn't want Tylenol. Patient doesn't want Tylenol. You're not going to force it on him. It takes cultural competency to understand that this is a patient's right, even though that this is the best for him, right? Patient is dying. I don't want intubation and DNR. Young patient, he said, I don't want, he explained it. Well, it takes cultural competency to, draw your boundaries, know where to stop, right? So I talked about people skills. This is another goal, emotional intelligence, stress management and the rest. It's also a great goal to learn about time management because the patients are allocated to you. Those times are not forever. You're not going to stay forever, 1 hour seeing a patient, right, in the clinic. 10, 15, 20 minutes, depending on the case stratification. You want to learn efficient workflow and manage, balancing patient care, chatting, time that you're using in rounding, times you're using to effectively have meetings, right? So time management and organizational skills is something very, very important to learn in a residency, right? Prioritizing which of them. I have two calls, one in the ward, nurse telling me blood pressure is 180 over 60, 180 over 60, another one ED calling, we have an admission of somebody with numbness on the right side of the face. I got to prioritize. So prioritizing documentation accurately, even to write notes. Every day we improve our notes, what we're supposed to put, ICD code, no ICD code, diagnosis, no ICD, and how to support your diagnosis, billing charts, and all those things. They all fall under time management and organizational skills. So you want to be able to grow in time management and organizational skills, right? And lastly, or so many others, I will not say lastly, there are so many other things, so many goals like research and evidence-based practice. Right? You want to see how to continue on your research trajectory, especially many of us have done research in the past, how to continue your research trajectory and, use your understanding of research and to apply evidence-based care to your patients, right? Or involve in clinical research that will help to, advance medical knowledge and improve patient care practices, right? Other things that come to my mind are like patient advocacy, right? The ability to, advocate for your patient, ensuring that your patient receive appropriate referrals. Sometimes we discharge patients, they don't even have a follow-up, and then they're leaving. And then they come back the next day because they don't have where to go, right? But if we're taking our time to appropriately advocate for them, make sure that, oh, do you have a primary care? Who's your primary care? Refer and communicate to that primary care that this patient is leaving hospital with post-CVA or post-heart failure. We change his recommendation, we change the medication, print out a discharge summary for the patient and give it to the patient and say, take it to your primary care or fax it to the primary care, right? Some patients need social services, end-of-life care, and all access to care. They don't even have access to care insurance for your ability to say, okay, I know Medicaid may approve you. Let's talk to a social worker. Let's talk to the case manager, right? I mean, no Medicaid, you may qualify for Medicaid. There's some benefits you may get. I have this hospital right over there that does pay as you go. That's a cash model. I have this hospital that is what they call those hospitals that do government treatments, FAQC or FA federally health qualified, hospitals. Your ability to learn that these are goals to optimize care in patient. And lastly, but not least, ethical standards, right? Ethical decisions, when to present end-of-life goals, when to present, do not resuscitate, when to present, what they call the other one, when the patient has less than like 6 months life expectancy, what they call it. Um,
Hospice?
yeah, hospice.
Hospice.
Right? When to present hospice and comfort care to your patients. So all these are ethical dilemmas, euthanasias and the rest, abortions and the rest, right? Confidentiality and privacy. Patients tell you a lot of things, and then the husband comes to tell you, please tell me what is going on with my wife. And he's not even doesn't have power of attorney or next of kin or whatever. So those are goals, ethical goals and professionalisms are goals that you aim to achieve in residency. I know this is one aspect of interview. Don't make it too long. The reason why I made it too long is I had to go through like, a list in my head of what I've noted down for myself to grow as I practice family medicine, right? And that should be a goal for a resident. It's different from tell me your goals in 5 years. Or tell me, where do you want to see yourself in 10 years? Those are long-term goals. Your short-term goals to become proficient in patient care management. And you can list any one or two or three categories in those that I've mentioned, right? Patient advocacy, ethical and professionalism, research and evidence-based care, um, time management, emotional intelligence or people soft skills, interpersonal communications, procedural skills, and so on and so forth that you can, that you can say. Just pick like three or two and add a little flesh in them and say and then conclude with, you can start with, I have so many goals in residency, but I'll just talk briefly about three of them. First, second, and third. And then you close. And I hope that when I begin residency, I'll make significant improvement in these areas of my short-term goals. These areas of growth in a resident, you can also bring it in some questions that they are going to ask you. So it's good that I took my time to teach this part, so that if there's a question that they ask you relating to, how do you want to function? What do you want to do when you come into residency? There's so many ways they phrase those questions that you could see, that you could tap in from one of this knowledge that I've mentioned. And truly, truly, all of us that are residents or that are aspiring to be residents, these are very critical things that we should look at improving on ourselves every day. Thank you, everyone, for this such short session. My name is Dr. Kobe. This is IMG Research Academy. In IMG Research Academy, we do all things clinical research and then see how we can support ourselves, especially foreign trained physicians, not only foreign trained physicians, physicians that are trained in the US, to see how we can improve patient care, get into residency or fellowship and become better. Thank you once more. The two candidates, our top candidates, they've given us permission to share this, and then we wish you best in your interview preparations.